2022. So you all must be aware of the dreaded disease malaria. Many of the people who have the medicines as well as the need for vaccinations. So despite steady advances in lowering global burden of malaria between 2000 and 2015, progress has slowed or stalled in recent years. As we can see in our developed or urban areas, we hardly see any cases. So however, the major burden of the disease is seen in the subcontinent, particularly in the African regions, and lesser common in parts of our country. So what needs actually to be done? What are the measures? So urgent and concerted action is needed to set the world back on a trajectory towards achieving 2030 targets of WHO Global Malaria Strategy, that is total eradication. So it is a known fact that malaria is a preventable and treatable disease that continues to have a devastating impact on health and livelihood of people around the world. In 2020, there were an estimated 241 million new cases of malaria, and 620, a brief data of the number, there was an estimated 241 million cases of malaria worldwide. So as we all know, malaria is a life-threatening disease caused by parasites that are transmitted to people through bite of infected female Anopheles mosquitoes, and it is totally preventable and it is curable. The estimated deaths are expected to rise if the immediate environmental action is not taken. So in 2020, the region was home to 95% of malaria cases and 96% of malaria deaths. So this is particularly, the numbers are from Africa, as majority of the cases reported are from Africa. So usually understanding malaria, it starts with basic fever, associated with high chills, then profuse sweatings and body pains, and if diagnosed and not treated on time, might lead to death as well. So there are almost 5 parasite species of it, and the most commonest one is curable disease. So over the last 2 decades, expanded access to WHO recommended malaria prevention tools and strategies, including effective vector control and use of preventive antiation, particularly during the seasonal times. These medicines, where the disease is more endemic and more requires, frequently there are cases been reported. So empirical medicines might be given to the subset of the population as well. And as soon as the symptoms are seen, and we need to immediately test the patient for that. Nowadays, excellent diagnostic tools are available to diagnose this disease and to immediately identify, even it is a very early stage as well, because the IgM investigation, the IgM pattern of these kits have come. So even the minute test entry of the parasite in the bloodstream would show. So coming to the vaccine aspect, since October 2021, WHO also recommends broad use of RTS AS01 malaria vaccine among the children living in regions with moderate and high falciparum malaria transmission. The vaccine has been shown to send deadly severe malaria among young children. So what are the treatment aspects what we have, and the treatment challenges what we have? So the treatment aspects basically are the most important thing. As we can see, the artemisinin group of medicines which are commonly employed in treating and simultaneously supported by other drugs. So what are the challenges? As we can see, as we have heard of the term like antimicrobial resistance or antibiotic resistance or several resistance, there have been resistance to anti-malarial drugs also. So this is the most important challenge. So WHO of late has strongly recommended in their past 2 to 3 revised guidelines as well to use more than one drug. Now, instead of using one drug, they advocate the use of more than two drugs to overcome the resistance and help in total eradication of the parasite from the bloodstream, so that the patient gets better and there are no recurrences and there is no resistance. So the coming future, what is the WHO response? What did the WHO has planned? What it has given the whole world a program? The global technical strategy for malaria, that is from 2016 to 2030. It is all updated last year. So the most important aspect is reducing malaria incidence by at least 90%. That's a big number, big by 2030. Reducing malaria mortality by 90% by 2030. Eliminating malaria in at least 35 countries by 2030, and preventing resurgence of malaria in all countries that are malaria free. So these are all the basic things that why reason we are celebrating World Malaria Day. So in any case, if anyone have questions, we can. So one question was who is at most risk of developing very sick? Who is most at risk of getting very sick and dying from malaria? See, the only thing is everyone is at risk actually, particularly the area, the zone where the disease is more prevalent, where the ideal survival things are given for the parasite to grow, that is stagnant water and fresh water and lots of jungles and tree and unhygienic areas settling around the city or a village, wherever it is. So all ages are expected to develop any kind of, particularly it has been seen in infants, as children who contract this disease usually might not show initial symptoms, but the disease really progresses very fast in them, and to fight out the complication we have restricted dosages, and it will take some time for things to help, and particularly same goes with the elderly as well. The elderly individuals have the similar pattern of developing severe disease as well, and people who have who are never been subjected nor been heard of any kind of this disease and developing the disease for the first time, and foreign travelers are at risk of developing the severe disease, as the immune system also makes an impact, and people living in the subcontinent, in the tropical areas, they initially handle the disease, the younger individual handles the disease, then over the time, if not treated, they start giving up. But other population subsets, right from the day one, they start start to show very severe symptoms. So the mortality, it's to be known, particularly when you travel out, talking about our country, and many of you might be traveling to farmhouses or jungles, or go for camping, or hilly areas, or to their villages and all, where the favorable condition for the mosquito to breed is the ideal rainy season. So that period of time, the high transmission of this disease is there. So you need to be very careful and choose the ideal and have a proper knowledge of it. Second question is, how soon will a patient feel sick after being bitten or infected from an infected mosquito? Usually Initially, after the patient been bitten from an infective female Anopheles mosquito, it will take about almost 7 to 10 days to show symptoms. But thereafter, once a person starts to show symptoms, the onset of symptom and the severity will increase very progressively. So in that consequence, we need to get it tested immediately and start the treatment at the earliest. One more question is, how do I know if I have malaria for sure? See, there are many new investigation approaches, diagnostic tools, where very excellent results and very sensitive results are being given. The first thing would be under seeing under a microscope, seeing a blood smear under a microscope might show the parasite immediately. Whereas other blood investigations like parasite VNF, that is the kit based the rapid card test. These are all the tests which are very sensitive and can detect a minutest entry of the parasite into the bloodstream. So one question is, patient is 4 months pregnant and have detected with malaria. Should she be worried? Yes, it's a pattern cause of worry, because there have been reports suggested that if a mother is tested malaria positive, there might be high chances of the infant, the baby, getting positive also, as transplacental transmissibility is also possible. But people don't understand the complications of malaria, which are remain untreated. Usually what happens, the falciparum malaria particularly, they might attack the brain as well, and causing severe brain disease leading to death instantaneously. That is the most dreaded side effect of falciparum malaria infection. And once the parasite migrates to the brain, it really causes havoc. Patient might have seizures, might have high grade fever, patient might immediately go on to the ventilator. So it is not a disease to be taken lightly or taken for granted, because it's been years over the time the urbanization of several states have cities have taken place, and due to which to much extent the disease has come down in our country, but it has not been totally eradicated. There tend to be incidences of cases in remote villages and surrounding districts. Patient keep reporting, and we should be very particular on that. So what happens if malaria if left untreated? I have discussed before. And what is cerebral malaria? I have discussed when the infection continues to progress and it enters the brain. So there causes severe neurological symptoms like headache, blurring of vision, vomiting, seizures, and patient might ultimately land up in coma if not treated. What is known about the long-term effect of drugs that are commonly used to prevent malaria? See, the good thing about the anti-malarial drugs, that they are not to be taken for months together. Once positive, there is a regimen of 2 to 3 weeks that can be taken, and after that it can be immediately stopped. For the treatment regimes are different for both falciparum as well as the vivax type of malaria. For falciparum malaria, the artemisinin type, that is, it is given in an injectable form and simultaneously with associated. And coming with for chloroquine is used most commonly in vivax infections. And chloroquine, as many of people might have taken in the recent past owing to the pandemic, the commonest side effects would be stomach upset, nausea, vomiting, headache, appearance of jaundice. These are all the common side effects of anti-malarial drugs, and palpitations as well. Should infants and children be given anti-malarial drugs? Why would they be? Unless and until they are positive, malaria positive, they should not be given. And once they are positive, they should be treated accordingly for the treatment. disease specific, the parasite specific, or to be more frank, the species specific. So, one more question is, patient wants to get pregnant, and after return from an area where malaria transmission occurs, how long does it take for anti-malarial drugs to clear the body? See, pregnancy is a state in, very few antimicrobial, anti-malarial drugs are recommended. So, one of them, few of very couple of drugs are advocated, and once if the patient is in subclinical stage, or the most commonly called the asymptomatic phase, where the patient might be a carrier, but patient might not show the whole symptoms as well. So that time patient first needs to get tested, and patient, if the patient is symptomatic, and almost after 2 to 3 weeks there is total eradication. Within the first week of the treatment there is total eradication. However, to make sure that total eradication of the parasite is to be observed in the whole bloodstream from the whole body, that the recommendation goes for 2 weeks. When is it considered safe for mother to breastfeed while taking anti-malarial? Yes, it is considered to be safe, and breastfeeding to be continued. Another one, malaria is when is malaria self-treatment recommended? See, usually we don't advise self-treatment recommendation, but there is a term called mass drug schedule. That is, if the season is there for parasite and cases have started to appear to show positive, then the whole subset of the population is given an empirical treatment. Whichever subset of malaria parasite is there, the set of population is given, mass population is given anti-malarial drug. Are repellent useful to prevent malaria? Yes, absolutely. There are two preventable strategies. One is the spraying of anti-mosquito repellents, and the second being use of the protective nets. Is fever the only symptom of malaria? No, there are many other symptoms of malaria. Patient might have start with a basic fever with severe chills and profuse sweating. Of patient developing a very high grade fever, then the fever coming down with severe sweating. Then after this, the phase might repeat after 24 to 48 hours again. So this phase goes on continue, and later, as we all know, it attacks the RBCs. The parasite feeds on the RBCs. So patient might be might appear pale, or the hemoglobin count might be also initially decreased. There might be appearance of jaundice as well, due to large number of destruction of RBCs as well. What is difference between malaria and dengue? Yeah, there is lot of difference between dengue and malaria. Malaria is a parasitic disease, whereas dengue is a viral disease. It is both are mosquito borne, both are caused by mosquitoes, but this is a parasite and this is a virus, the dengue virus. So the thing is, both have got different signs and symptoms. Dengue is often called as breakbone fever, and which causes severe headache, reddish eyes, and multiple joint pains, particularly in the spine. And later on, there in the hallmark of dengue fever would be decrease in the platelet count, very severe drop in the platelet count, thereby causing severe dehydration and complications start. Whereas in malaria, there tends to be increase. Malaria has migrated to, for suppose, in the brain, the cerebral malaria, then patient would be totally bedridden, is totally treatable, and total eradication has been seen, and satisfactorily treatments are available for cure of this disease. One more question is, what are the chances of reoccurrence of malaria? The reoccurrence are quite high in the endemic zones, where highly concentrated areas of malaria cases been reported. a patient might continue to have a reinfection as well. It need not be a patient who is infected previously might have an immunity from coming future infections. No, a patient might have a reinfection as well after being bitten again from an infected mosquito. So with this, I hope a basic, most of you might be quite aware with the malaria disease, but this year's emphasis on observing World Malaria Day is to make more make yourself more available in preventing this disease, and almost to much extent we have been successful enough in preventing this disease and being treating this disease. So in future as well, there are the aim of globally should be to eradicate this disease permanently, rather than the other rural areas being where population is subjected to frequent malarial infection. So this might have made easier for you to understand at least the basic norms of the disease. The details are in the most aspects, but I have initially discussed the overview of a disease totally, the numbers, the reason, and the amount of the disease burden to be discussed, so that you come to know that what's with the disease, so that further measures are taken. So I thank you all for your patient listening. With this, I hope that everyone will start taking enough preventive measures in treating malaria, and simultaneously in an effort to prevent this disease, you might be helping yourself and the community in preventing other mosquito related diseases as well. Thank you so much.